Okay. Well, everyone, welcome everyone to the first of a series of webinars that the American Spaniel Club Foundation is happy to host. I'd like to introduce myself for those that don't know me. I am Dr. Fulvia Bartoli, and I serve as the Health and Research Chair for the Foundation. We start this series of seminars with a subject that is very, very dear to our spaniel breeders and owners, and generally all dogs are affected, which is blood diseases and the very, very feared immune-mediated hemolytic anemia. The title of tonight's seminar is Blood Production and Clotting When It Goes Wrong. And our first speaker is Dr. Tracy Stokol. She is a professor of clinical pathology at Cornell Veterinary School in New York, very cold New York. And she obtained her veterinary degree and her PhD from the University of Melbourne. Her PhD was on canine von Willebrand disease in Melbourne, like I said. In the US, she worked at Cornell University as an instructor in clinical pathology. She was then board certified, did a postdoctoral fellowship at Harvard, very impressive, and returned to Cornell University as a professor of clinical pathology. She performs clinical diagnostic service. She teaches veterinary students, veterinarians, and residents, and performs clinical and basic research. Her research interests encompass hemostatic and hematopoietic diseases in animals, cancer biomarkers, and the mechanism of cancer metastasis. Among Dr. Stokol's interests is the study of the immune-mediated hemolytic anemia in Cocker Spaniels, and the American Kennel Club and Canine Health Foundation awarded her grant entitled Plasminogen Activator Inhibitor 1 and Impaired Fibrinolysis in Immune-Mediated Hemolytic Anemia. The American Spaniel Club Foundation proudly supports this research with a significant contribution made possible through the generous contributions of all the American Spaniel Club members. And we welcome you and we give you the screen. Therefore, Tracy.
Well, firstly, I would like to thank you, Dr. Bartoli, for inviting me to speak at your webinar. And I also really want to sincerely thank your club for the tremendous support that you gave me in applying for the grant and getting the grant, and just the enthusiasm in our regular communications and you asking me for updates, which is great. So I really appreciate all of that. And I'm happy to talk to you. And I just would like to give you, what I'm going to be talking about. I'll talk about immune-mediated hemolytic anemia first. And just because it's such a mouthful, I'm going to abbreviate it to IMHA, as we all know it. And I'm going to talk about that first because obviously that's very dear to your hearts. But you did ask me to cover some other topics, and let's see if we have time to get there. I'd like to make this pretty informal. I'm not here to lecture at you. I'm more here to have an open discussion and you can ask me questions. Just understand that I work in the diagnosis side of things and I don't work with treatment. So I don't know I do know what the current treatments are, but that's not my area of expertise, and I will refer you maybe to other people, or I'm very happy to say I don't know the answer to that question. I can't answer that question. So I'm going to share my screen, and essentially my presentation is mostly what the disease is. It's just an explanation of the disease and then just the information that we know that pertains specifically to Cocker Spaniels. So hopefully you can see my screen. Can you guys all see it? Okay,
Yes.
excellent. That's great. Thanks. So as we said, blood production and clotting, there's a lot that can go wrong, and we're only going to touch on a couple of diseases. But let's jump into IMHA first. So what is IMHA? Well, it's a disorder of the blood in which the body's immune system essentially attacks itself, but it targets the attack against the red blood cells in the body. So this is the schematic, and I should say this is created with biorender.com. This is a schematic of a red blood cell, and as we know, red blood cells carry oxygen to all the parts of our body, and when we don't have enough red blood cells, we become anemic. And that's what immune-mediated hemolytic anemia is. It's an anemia because we don't have enough red cells, and that's essentially because they're getting destroyed prematurely. They should live out their long lifespan, which is 120 days in the dog. And unfortunately, in this disease, they get eaten really quickly so that they don't live as long. And that's why the dogs get anemia, because their bone marrow production cannot keep up with how quickly they're getting destroyed. So what actually happens with an immune-mediated hemolytic anemia? Well, we do know that antibodies are produced in the dog's body, and these antibodies, for some reason, target red blood cells. And we really don't know why these antibodies are produced, what triggers their production, and why they focus on the red cell and want to bind to the red cells. But essentially what they do is these antibodies bind to the red cells because they're recognizing specific proteins on the red cell membrane that they can then attach to the red cell membrane. And after they attach to the red cell membrane, that can be enough to help removal of the red cell. But they also, what they do is they cause an activation of the complement system, which is this complex series of proteins in the body. But essentially this complement, or these proteins, which are depicted here in green, are also either fixed to the red cells and are attracted by the antibodies, so that it's not only the antibody in the red cells, it's also these complement proteins, and that contributes to why the red cells get destroyed. So how do the red cells get destroyed in the body? Well, essentially there are cells in our body called macrophages, which is depicted here by this purple cell. And these macrophages essentially hang out in the organs like our spleen and our liver and our bone marrow. And their normal role is to actually remove red cells that have finished their lifespan. So we have to get rid of them somehow, and these macrophages do it. But what the problem is with IMHA is now we have red cells that have things bound to them that they normally wouldn't have bound to them, including these antibodies and the complement. And these macrophages actually have receptors which can recognize these, such that the macrophages eats the red cell and then destroys it. And as part of destroying the red cell, they can produce bilirubin, which is a byproduct of hemoglobin within the red cell. And some of these dogs can become jaundiced or yellow, as I'm sure you guys are aware. And essentially, because these macrophages are eating up red cells very quickly, because obviously there's lots of antibody or complement bound to them, we get an anemia. And this is just a picture of a dog with immune-mediated hemolytic anemia. And normally we should have lots more red cells, which are these red things, which is great because they're red in color when we look at them. There should be lots more of them, and there's a lot of white space here where there are not very many red cells. So this dog is anemic, and we can tell it's an immune-mediated hemolytic anemia often from the blood, because there's characteristic red blood cell changes that we look for. So the other thing that the complement does is that it can actually, when it binds to the red cell membrane, it's not only that the red cell gets eaten by the macrophage, but it can actually cause the red blood cell to rupture in the circulation. And when it ruptures in the circulation, it releases its contents, which is essentially the oxygen carrying molecule hemoglobin. And that hemoglobin is then free in the blood and it gets rapidly filtered out through the urine. So sometimes these dogs come in because they're very weak and lethargic, and they actually have red urine. And some owners may notice that red urine, which is not blood in the urine, it's actually hemoglobin, even though they look very similar just looking at the urine, which is depicted here versus a normal urine over there. And that can often be why the dogs present, because they're not going on as good walks as they used to. They could be very weak, they're not jumping around, or they actually go off their food. There's a whole variety of clinical signs that dogs with IMHA can present. And we're very particularly concerned about this manifestation of IMHA when we get what we call intravascular hemolysis, when the red cells actually rupture within the blood vessels, just because the hemoglobin that's released is quite toxic. And it's toxic to the endothelial cells, which are the blood cells lining all our blood vessels. And it's also toxic to the kidneys. And a lot of dogs with this intravascular hemolysis and these ruptured red cells do much more poorly than those dogs that don't have this extra component of red cell destruction. So it's just another way that red cells are destroyed in immune-mediated hemolytic anemia. So that's essentially what happens. And what we do when we treat dogs with IMHA, we're giving immunosuppressive drugs, or drugs that suppress that immune system, decrease the macrophages' ability to eat the red cells, and decrease those antibodies and the complement that they're fixing, so that they're not getting eaten as quickly, and allowing the bone marrow time to produce more red cells, and just letting equilibrium be reestablished and the dog to respond to an anemia. So that's essentially how we treat it. But, you know, immune-mediated hemolytic anemia also has other side effects. And one of them is that we know that dogs with immune-mediated hemolytic anemia throw blood clots. And these blood clots here, and this is just depicted here, I just got, even though this is related to COVID-19, it was a really pretty picture, which I could not duplicate myself. So I just grabbed it off the web. And we don't really know why these dogs clot. We have lots of theories as to why they clot. It's probably multiple reasons why they clot. But if you look here, you have red cells as well as other cells such as platelets caught up within this fibrous network, which is called fibrin. And the grant that I wrote is essentially a theory that we have, in that one of the reasons why dogs are clotting, they are throwing clots, but we believe that the clots are persisting longer in these dogs because there's normally a enzyme system that eats away the clot and breaks down that fibrin, which we call fibrinolysis. And we believe that there's a protein that's increased in these dogs with IMHA that blocks the ability of the enzymes to break down the clot. So not only are they making clots more quickly, instead of breaking them down really quickly, which dogs typically do, they're not breaking them down as quickly, and that's why the clots stick around longer and actually cause the clinical problems. And that's essentially what the grant was written about. It's about targeting these proteins and finding out how much they are involved in abnormal clot formation and abnormal breakdown of fibrin in dogs with IMHA. And we're really ramping up with the project. We haven't enrolled very many dogs, but we're hoping to keep ramping that up. So I'm going to quit there and let you guys answer questions, and you can ask questions, not answer them. I'm happy for you to ask questions in the chat or verbally, really up to you.
Thank you. That was a beautiful overview. I have a few questions that have been written to me since we had requested from our members to please send me the questions. So from Lindy, we have, what is the best current treatment for IMHA? What is the realistic prognosis for a diagnosed IMHA?
So, I did some obviously looking up the recent literature on this, and things have definitely changed since, the 80s or 90s, where the prognosis was pretty poor with IMHA. So a lot of dogs would die. So the prognosis varied between 32 and 50%. So at least half of the dogs would die. But we're doing way, way better now. Absolutely way better. We are treating these dogs much more aggressively. We're recognizing it more quickly. And we've got more drugs at our disposal, and exactly. So what is the best treatment? That is very controversial, and it really depends on where you went to school and what your lecturers taught you and what they preferred. And at Cornell, we use a drug called mycophenolate together with corticosteroids. And corticosteroids, or prednisone, is the most common immunosuppressive drug used across the board for almost every disorder where the body attacks itself. And it's a great drug on one hand because it's very effective, but it's an awful drug on the other hand because it's got these awful side effects, and I hate it. I think it's an evil drug, but it's an evil necessity because it changes your dog's personality. It makes them want to drink and eat too much. It makes them loopy in the brain, and it affects, particularly when they're in very high doses. So at Cornell, we try and decrease the dose that we give them by giving other immunosuppressive drugs. And currently they like mycophenolate. I'm not going to say that's the best drug because there's no studies out there that have really done a good job saying we're going to randomize treatment of these dogs and you come in the door, we're going to give you this treatment. You come in the door, we're going to give you that treatment, and we're just going to flip a coin and decide who gets what. We're not going to tailor it and specify that this group gets this treatment and that group gets another treatment because that biases the study. And honestly, we haven't done those studies. They probably are needed, and it's probably should be done across institutions to do a very nice multi-center study with lots of dogs, and then just randomized treatment, come up with these are the treatments we want to compare. And a lot of places are adding antithrombotic medications, the drugs to prevent thrombosis. And again, we use a specific drug at Cornell, but other places use different antithrombotic drugs, and they may say, well, we do better than you. But again, there's really no hard data to support that one way or the other. But the more recent papers are showing a 60 to 70% survival rate with IMHA. A lot of people have looked at the factors that make the dogs die quicker, and we know that the jaundice is one of them. Certainly the higher the amount of bilirubin, or the more jaundiced you are, the worse your prognosis. And definitely dogs that clot are going to do more poorly, and dogs that have that intravascular hemolysis with the free hemoglobin, because as I said, that free hemoglobin is not good for the body. So those are the things that we know, but honestly, the prognostic factors vary by study as well. So sorry, that was a long answer to that question.
And absolutely, it was beautiful. From what I have read and from conversations that I've had both with you and with Dr. Stephen Friedenberg, and obviously based on your grant, on this grant, on the plasminogen activator inhibitor, my thought is to address this initially as attacking it with immune suppressive drugs, but then moving on to anticoagulants and antithrombotic medications, because then it becomes a coagulation issue. And I think that identifying the levels of the plasminogen activator inhibitor, it will be a key towards this treatment.
Yeah, and we're hoping it is. So, you know, and really, I'm going to give credit for the grant is with Stephen Friedenberg, who's at the University of Minnesota. And, you know, Steve was a Cornell student, and I loved him as a student, and I wish he'd done ClinPath because he was so smart, but he decided to do emergency and critical care and then become into genetics. But he's done some really lovely studies which kind of triggered the grant, because he said to me, you know, Tracy, I found this, you know, here's our accepted publication. What do you think the next step is? And we had this great scientific discussion. I said, well, this is to me is the next logical step. And I said, you know, why don't you write a grant for the AKC? Because they said to him, you know, you did so well, we'd like you to resubmit a grant. And then he said, oh, I think you should write it. It's like, okay, great. So let's write it together. So we're co-primary investigators. And, you know, came out of the work that he did, showing that the level of this protein that inhibits fibrinolysis or breakdown of the fibrin, which is this fiber structure that binds the clot and really makes it very firm and stick around. He found doing his RNA sequencing of blood of these IMHA dogs that some of these dogs, a lot of them had very high Pi1, which is the plasminogen activator inhibitor. And it's the main inhibitor of the protein that triggers breakdown of the clot. So if that's up, this Pi1 is up, then the protein that should initiate clot breakdown isn't going to be working as well. So the clots aren't going to be broken down. And another colleague of mine, Dr. Robert Goggs, who's another veterinary, he works in veterinary emergency and critical care, he's a criticalist. He has some data from IMHA dogs showing that they don't break down their clots that quickly with a particular instrument that we can use in the lab. And we're actually going to be using that instrument to test our theory that the reason why these dogs might not be breaking down their clots is because Pi1 is up. So we're taking Stephen's data, which is just mRNA, and asking, is the protein actually up and is it active? And then can we use these assays to determine which dogs have the protein being increased and are at the most risk of throwing a blood clot? And then the hope would be to really target the right anticoagulants to those dogs and add that to the immunosuppressive therapy. It's never going to be a therapy alone. We have to stop the immune system from being overactivated. So this is additive, but it will help with the mortality and also just the dog just not feeling good because there's all this tissue injury occurring from the blood clots that happen. So hopefully it will help with the dog's general well-being and let the steroids and the other drugs do their work. So it's never going to be a standalone therapy. It will always be together with the immunosuppressive drugs.
Immunosuppressive. Let's have some questions from other members of the audience. Glenys, you had some questions?
Happy for you to put it in the chat as well if you would like.
Glenys, can you please raise the volume? We cannot hear you. Okay. Glenys is trying to figure that part out. Maybe Holly. I know that Holly also wanted to ask questions.
Yeah, I had a question on whether or not there's any current testing on either the sire or the dam, you know, as far as like preventative type measures can be taken. I had a boy, he was only 8 years old, and what happened is his mother had glaucoma. His eyes started getting a little puffy. I took him to the vet. The vet diagnosed him with glaucoma, gave me eye drops. 2 days later, this dog, he was not sick a day in his life. This dog was healthy as could be. 2 days later, I called the vet and I said, no, the dog seems to be in distress. Would you want to see him again? No. And I said, how about let's just do some labs on him and see what's going on. No, we'll just give him some pain meds. So, I got the pain meds, gave it to him. 3 hours later, the dog had blood clots coming out of his mouth. He had blood all over his bed. I rushed him to the vet, the emergency vet. And for 4 hours, they were giving him meds and trying to pull some labs, draw some blood from him. And they said every time they tried, there was clots. The blood was clotting as quickly as they were trying to draw the blood. And they said that there was nothing more that they could do for him. And we ended up having to put the dog down. And now I have his mother. I have, so I don't know, is it coming from his mother? Is it coming from the father? And then depending on that, there are 6 dogs out there that I'm kind of trying to figure out. I mean, could they be susceptible to it? Is it genetic that, you know, I need to be watching these other 6 dogs? I'm a little confused and concerned.
Yeah, I completely get that. That's really sad. I'm really sorry to hear that story. That is very sad. So as far as IMHA goes, because there's such a strong breed predisposition, and Cocker Spaniels are one of the breeds that are predisposed, we see it a lot in that breed, including the intravascular hemolysis form. We do believe there must be a genetic component, but exactly what it is, unfortunately, we don't know. And I'm not exactly sure what was going on with the dog, whether it had immune-mediated thrombocytopenia or had something else going on, really unclear. But there's probably an immune genetic component to that as well. The problem is that we haven't yet uncovered what that gene is. And it's probably because it's such a complex disorder involving red blood cells. It involves the immune system, and the immune system is so complex. It's probably not going to be a one gene trait. So we're not going to be able to identify one genetic defect that we could test for, like you can with, say, von Willebrand disease, as an example, or hemophilia A. So as far as watching the other dogs, I think it's always good to know, is it occurring in that bloodline, because that would support that there was a genetic basis, or it could have just been a random one-off, just unfortunate, unlucky thing that may never happen again. But to answer your question, are there any things you can test the parents for? No, because A, we don't know what was truly wrong with the dog. And B, with IMHA, even though we suspect there's a genetic predilection for it, we don't know how to test for that because we don't have the data, which is unfortunate.
The emergency vet told me that that's how she diagnosed him, as IMHA.
Okay.
So that was her diagnosis. And then I asked her, well, what can we do? What kind of medication or anything? And she said at this point, because they can't eat, his blood is clotting so quickly. And she said, frankly, I've never seen a dog's blood clot as quickly as his is. I don't know if, I mean, I was actually second guessing myself. I took him to this emergency vet. Maybe I should have went somewhere else. I was frantic when I saw all this blood coming out of this dog's mouth. And like tissue, I guess the blood clots. I've never seen anything like it. It was truly horrible.
Oh yes, that would be. I can see that. I'm really sorry that you went through that. It's awful, but unfortunately we don't know. We don't have any genetic test or test that can tell us which dog is going to develop it. That would be the pretty much the holy grail of IMHAs if we could, because then we could hopefully breed it out. But I think it's a complex play of not only genetics. We think there are environmental factors that help trigger the disease. So it's like a combination of the dog's own genetics and the environment they're in. And if they live in an environment where they never see a trigger that activates that immune system, they may never develop the disease. But put the same dog in a different environment, they might develop the disease. And again, we are suspicious of these triggers, but we don't know exactly what they are.
I have a question from, again, from Lindy. She asks, is over-vaccination a contributing factor for the disease? So this is right at this moment is perfect.
Yeah, so, there's going to be strong opinions on this one way or the other. And there was definitely some earlier studies that suggested a fairly loose association between vaccination and development of IMHA. There was a more recent study, again, it's not a lot of dogs, it was only like 40 or 50 dogs, showing that there was no relationship with vaccination and the dogs that developed IMHA. But, is vaccination, which activates the immune system, one of the potential triggers? I'm not going to say no, but I don't think it's the main trigger, and I don't think it's the only trigger. I think there are other things out there, and we just don't know what they are. For instance, we definitely in the northeastern United States have a seasonal incidence of IMHA. We usually see it more in spring than any other time of the year. Now, do we see it other times of the year? Sure we do, but we seem to get a run of it at a particular time of the year, and that's the same with Minnesota. But then another paper came out saying, well, it really depends on the region because there's no seasonal incidence. So it really depends on where you are. And who knows how access to ticks and all these tick-borne diseases is also going to change what happens. But unfortunately, we don't know exactly what the triggers are. And there's going to be some people who say, yes, vaccination is definitely a trigger, and others who are going to say, no, it's definitely not. And there's going to be people like me who's like, well, the evidence for it being a trigger is quite weak, but I'm not going to rule it out. So that's just my opinion.
I know that your grant is for American cockers. I know of one American cocker here who was definitely diagnosed with it at a very young age. I also know of 2 standard poodles. Same thing?
Well, the grant is not breed specific because it's just, are these dogs abnormally clotting? But, this raises an interesting question. There are various breeds, the Cocker Spaniel being one of them, that has a predisposition to IMHA, or that is a higher incidence of IMHA. There are other breeds other than Cocker Spaniels for sure. And what is it about those breeds that make them more susceptible to developing the disorder? We really don't know. I mean, they don't even know what triggers it in humans. They think it's an abnormal, there are these immune cells called Tregs, or regulatory T cells, which kind of dampen the immune response and control the immune response. And there's fairly decent data in humans and from mouse studies that these T regulatory cells are abnormal, they're acting abnormally in IMHA, and that's kind of one of the reasons why the immune system goes a little haywire. But they still don't know why, and the triggers there. And there certainly are associations, like in dogs, that are made with humans and certain diseases or certain drugs that can trigger it. But again, we still don't know why it happens in some people and some dog breeds than others. So unfortunately, we don't have the answers to the questions you guys most want answered, just because it's such a difficult thing to study because it's such a complex disorder.
The two standard poodles were related.
Yeah, and I've definitely heard that from Cocker Spaniels, that it's run in bloodlines, and that's kind of why we have this very strong suspicion that there is a genetic component to it. But is it only genetics? I think that's pretty unlikely. I think it's genetics and environment. And, you know, who knows what it is in the environment? We just don't know. It's very hard to do controlled studies where you can assess that.
Thank you.
Glenys, are you able to?
Could she email you the question? She could try emailing it to you.
I tried to get in touch with her, but I don't know. Glenys, can you send me the question? Can you put it in the chat? Addie, I see you're on. Would you like to ask a question?
I don't have anything right now.
I am trying to monitor to see if other people have, okay, I know that Glenys was interested in knowing if there are any triggers that causes it. And because there seems to be a number of cases in the UK, and they seem to be over a good age range. So I guess the triggers, you sort of already touched on that. And she mentions that as young as 2 and others as old as 10 are developing the disease.
Yeah, so again, you know, in a younger dog, and when they develop a condition really early, we think, okay, and particularly if it's in a particular breed, we think, all right, there's probably some breed disposition. So something's in this particular line that's just making them more susceptible. But again, we don't know what that is. In older animals, you know, they can be exposed to multiple things over and over again. It's like when you develop cancer, you know, we don't know why we develop cancer. And most of the theories are there's multiple hits that happen to your DNA and affect the DNA so that cells in your body become cancerous. But, you know, what are those multiple hits? Well, we know there's certain things that are carcinogens. And there are reports that dogs can develop IMHA after certain drugs and after bee stings and after snake bites. But, you know, they're just like one-off reports. And ultimately, we don't know the triggers. And they don't really know the triggers in humans either. But they can give you a list of disease associations or associations with season, for instance. And as I said, there was a new paper showing, well, I think it was in Northern California, there's seasonal, and if you're in Southern California, there isn't. So, but older dogs, you know, is it genetics or is it just the T cell immune system going crazy because of multiple environmental hits that just suddenly it says, okay, I've had enough, I'm going to go crazy and do something? Is it a viral infection that these dogs get that we're not aware of, and that makes your immune system go off? I mean, they certainly know that there's a lot of evidence in humans that what happens. It's kind of what you call mimicry, that there's something in a virus or a bacteria that mimics what's on the red cell. And so the body tries to get rid of the virus and the bacteria, and it attacks that component that mimics the same thing on its red cells. And that's kind of a bystander effect where your red cells get destroyed because the body is trying to rightly get rid of a bacteria or virus. we just really, unfortunately, have no idea. And the studies that are done are pretty small with low numbers of dogs. Again, we need like more multi-center, nationwide, international studies that can really do a good job of trying to look at statistical associations between defined factors. I mean, it would be really good to have those kinds of studies, but they're currently not being done as far as I'm aware, but they certainly could be, because I'm not aware of all the studies.
Glennis did send in her question.
Yes, yeah, and I saw that in the chat. And certainly, you know, Rimadyl is such a commonly used drug. Metacam I'm less familiar with, but Rimadyl is such a commonly used drug. If you look at how many dogs are on a drug and then the percentage that actually get IMHA, it's a very, very, very low percentage. So, you know, is it a true drug induction of the disease, or is it just a random event that occurred at the same time but was completely unrelated? But because you want to blame something, you blame the drug because that was new, like the glaucoma medication, for instance, in the previous example. It's highly unlikely it was, but we do know there are idiosyncratic drug reactions, and that you can give a drug to 1,000 people and one person has a reaction and has a bad reaction, and then we freak out because if that one person is your brother or sister, you know, you're not going to be happy about it. But in reality, you know, a lot of other people have had that drug and have had no problems with it. So, you know, it's really hard to study these associations and try and make head or tail of them when you're only looking at low numbers of dogs. We really need lots and lots. We need thousands of dogs in this kind of study to make it meaningful.
Okay, I have another question. What are the earliest common symptoms of the disease? What can the owner look for?
So generally, the anemia is thought to occur very acutely, and it really results in a very quick drop in the blood count or the hemoglobin count. And the most common things are the dog's going to be feeling not great. And so looking for a change in attitude, a change in temperament, and mostly weakness and lethargy, like not wanting to go for long walks, things like that, or, you know, just wanting to go for shorter walks. And I myself had, you know, a dog that was getting older, and he had his moods. There were some days he was like, yeah, I'm not feeling great. I don't feel like going for a long walk. I want to turn back. And, you know, always a part of me was like, oh, is something wrong with you? But then the next day he'd be fine. So, you know, it's usually a consistent thing that progressively gets worse as the anemia gets worse. But some of these dogs have a very slowly developing anemia, and those dogs can take a long time for an owner to become aware of them. Okay, but what could you do? You could get an idea of your dog's resting respiration rates. So how quickly does your dog breathe at different times of the day, like not after a walk or a run or exercise, but just resting when they're sleeping. What's their respiration rate? You can feel their heartbeat, and you can take their heart rate. And we did that fairly frequently with our dog. Like when he was like, oh, I'm feeling nauseous, we were like, oh, let's check your heart rate and respiratory rate. The respiratory rate can go up, but the heart rate doesn't usually go up a lot unless they're in pain or when they're stressed. And the heart rate does go up in IMHA because the blood, the heart is trying to work harder to get oxygen around the body. And it's not because there's a problem with the heart, it's more that there's not enough red cells to get the oxygen, but the heart thinks that it has to work harder. So they often have higher heart rates and respiratory rates. But, you know, because we rely on owners to notice something's wrong, do we catch these dogs really early? And the answer is no. We're usually catching them when they come in because they've acutely collapsed. But what are the other more subtle signs? And I would say just getting more tired than normal, much weaker, not wanting to do their normal stuff, particularly in a younger dog where you can't attribute it to age. And you can always like lift your dog's lip up and look at the color of their gums and see how pink they are and get a kind of feel for it. But I would do that on my dog, and I go, to my husband, oh, he looks anemic. I think we should get blood. And because I can't get blood easily and can test it pretty easily at Cornell, I would always test and I would always be wrong. He was just fine. But, I do think getting regular blood work is a good idea, and like having yearly checks. And then when your dog is an adult, you know what his baseline normal is, and then you can pick up if it's getting low. I mean, there's always fluctuation, right? So you don't want to overinterpret. If his heart rate's normally 70 and it goes to 80, I would let that go. But if it's persistently at 70, at 80, or it's going higher every time you measure it, and you're not stressing your dog out by taking its heart rate, that could be an indicator that there's a problem. But you kind of want to balance what is just variation from my dog and combine that with, oh, okay, but he's also not feeling himself. He's not eating as much. He normally eats all his food and he's leaving some of his food. All of those are subtle things that you can look for. And honestly, we all know our dogs better than anyone. And we all we pick up these really subtle signs quite quickly. And sometimes we overthink them and panic a little bit. I think something that's persisting and getting worse over time is definitely something that should be acted on. So hopefully that answers that question.
It does. And is there a quick differential diagnostic so that the veterinarian can pick this up quickly and obviously treat it just as fast? Because it can be confused with many other diseases. Just rat poison contamination, okay?
Yeah, it can be. And I mean, the key thing about looking at the blood is there are some clues in the blood smear as to that the dog has IMHA, but there's some dogs that don't have those clues. So as in the lab, if I have an anemic dog, I'm always looking at the blood and going, okay, can I find a reason why you're anemic? Because to me, the blood talks for the animal, and I'm the one looking at their blood. So I have to help the dog tell the vet and the owner what's going on with it. So it's my job to look, is there anything in the blood that can help that process and help the vet know what's going on with the dog? Because that's the way they talk to us. And with IMHA, in the very classic IMHA, there are classic lab findings that I can look at a blood smear from, really quickly and go, this dog has IMHA and I'm done and I know it. But, the clinicians are pretty good. And a lot of clinicians, I mean, every vet varies on how good they are, but there's a lot of really good vets that will be clued in and will think about it. And particularly in certain seasons where there is definitely a seasonal incidence of it. But yeah, the quicker it's recognized, the better. And you do need to do blood tests. And there are some dogs that you do the blood tests and you need to do a lot of them in order to prove that it has that disease. And so it can be very difficult to diagnose in some dogs for sure. But there are these classic lab changes, and those classic changes you see by looking at a blood smear, which is that picture I showed you in the previous, and I can go back to it. There are these very classic changes, which are these smaller red cells, which we call spherocytes, and lots of those tell us it's an IMHA. Vets also do this test called an agglutination test, where they're looking for red blood cells sticking together because the antibodies bind them together, those antibodies that were attached to the red cells, and this is all animated. But when you have all these antibodies binding, if you can imagine another red blood cell there, that it can be bound by the same antibody. So you get these clump of red cells, and they can do a really quick slide test to confirm it. But they're only going to do those tests with an index of suspicion, and that's with the dog with the right clinical signs and that are anemic when they do the blood test. So they probably do this, what's called a slide agglutination test really quickly. And if it's positive, it's a great quick test. But if it's negative, it's not always that sensitive, and it certainly is negative in some dogs, and they still have IMHA. I did get a question on respiratory rate variations. It has been published, and it does depend on the breed and the size of dogs. So I recommend you look up what is known for the breed. I actually have to look up respiration rates all the time in dogs. And actually a colleague of mine is a cardiologist, and he did a research study where they got owners to evaluate resting respiratory rates in their dogs. And I think most respiratory rates are around 30 to 40 per minute in most breeds of dogs. And my dog was always around 50 or 60. And the reason why he was doing it is because he thought an increase in respiratory rate when they were resting and sleeping could be an early marker of cardiac disease. And we know Cocker Spaniels do get mitral valve insufficiency and can get cardiac disease. And I think he might have published on that study. And if you guys are interested, I can try and find that and send the information to Dr. Bartoli, and she can share it with you guys.
Of course. Anyone else that is on that would like to ask about the anemia, or we can change the subject? Okay, I know that you have, well, your PhD was on von Willebrand disease, and it used to be more common, or at least I used to hear more about it in Cocker Spaniels. I don't hear it as much. That doesn't mean it's not there. So what is the information that you have?
So when I did my PhD, it was really primarily a Doberman issue and Scottish Terrier issue, just because of the such high prevalence in Dobermans, but also other breeds such as Rottweilers as well. And they have different types of von Willebrand disease. When Cocker Spaniels was not one that jumped in my head for von Willebrand disease, so I actually again had to look that up. And von Willebrand disease has been reported in Cocker Spaniels, and from what I've read, it's type 3 von Willebrand disease. And I did have some animations to show you what von Willebrand factor does, but essentially type 3 von Willebrand disease is the worst manifestation of the disease. It's when you don't have von Willebrand factor, which is pretty much, it's a protein that's found outside our blood vessels that helps these platelets stick to an injury in the vessel wall. And that's the first thing that has to happen in order for a clot to form to seal off that injury, is the platelets have to bind to it. And von Willebrand factor helps capture the platelets. So basically it's like a glue that helps the platelets. It's a very loose glue, but it helps the platelets bind and are captured in the area of the vessel injury. It's actually really cool how it does this. And I do have an animation, but I wasn't sure how long you wanted this to go on for. And so I didn't want to kind of overdo the lecture, but if you want, I can show you the animation. But what I've read about the Cocker Spaniels is that they get the type 3, which is they don't have any von Willebrand factor, and those dogs are the most severe bleeders, so they are more likely to bleed. But then saying that, I've seen von Willebrand disease diagnosed in a 13-year-old Shetland sheepdog with type 3 or severe von Willebrand disease that never bled in its life until it got to 13. So, you know, it lived out its life. And actually my PhD advisor adopted a Scottish Terrier with type 3 von Willebrand disease, and the dog did pretty well. He lived a fairly good life, but, you know, he avoided trauma and he didn't throw lots of things for the dog to, you know, injure himself. And the dog did pretty well. So as a bleeding disease, it's not as bad as hemophilia A, where the dogs really can have quite a poor quality of life because they're more likely to bleed severely. And also being a smaller breed, like a Cocker Spaniel is a smaller breed, maybe less likely to get traumatized to the degree like a German Shepherd with hemophilia A, where they get bleeding into their joints. You don't get that with von Willebrand disease.
Recently, there has been a report of a Bernard Selear happening in Cocker Spaniels.
Yeah, and I meant to look that up because Bernard Selear syndrome, which is it's a defect in one of the proteins on the platelet. It's actually the defect on the receptor that binds to von Willebrand factor. So von Willebrand factor doesn't, the platelets have to bind via a specific receptor, and Bernard Selear syndrome in humans is a defect in that receptor, so they can't bind von Willebrand factor, so they can't be captured in fast flowing blood, essentially, is what that boils down to. And yeah, and it's only recently been diagnosed in dogs, because I was just like looking something up. I'm like, Bernard Selear, has that been reported in dogs? And then I'm like, oh my God, there's a report, and I forgot to look up the breed. So, you know, I think it's very, very rare. And I can't remember the paper well enough because I read it quite a while ago to know if they figured out the exact defect and whether it was just a one-off mutation or was in the bloodline. So.
What I read the paper, and it was a mutation. They found a deletion. Right now, unfortunately, I cannot remember if it was in the because this is the glycoprotein 2B3A, and
no, that's Glanzmann's thrombocythemia. That's a different thing.
yes,
Bernard,
yes, I'm sorry.
Yeah, Bernard Selear GP1B.
Right, and they found that there was a deletion. It was only observed when the dog, because the dog went into surgery, and obviously, you know, it bled, and then they tested, and it was really contained to that family of 4. And they had 90 negative controls, which was very good. But
yeah,
it was, yes, it was in Cocker Spaniels.
Yeah, so that's probably just a one-off mutation. It's like there's a lot of, in humans, there's a lot of hemophilia A mutations that actually are not like carried, that are not, or I think 20% of hemophilia A, which is factor VIII deficiency, in humans at some point in time, I remember this number, but it could have changed, are de novo mutations, so brand new mutations that occur. So that are not inherited. And I think that's probably what that breed was. So I don't think you guys need to worry about one report unless it starts showing up in other Cocker Spaniels, because essentially you're going to get any inherited disease in any breed, and you just hope you're not the unlucky one to get it.
Yeah. I have a question from Carol, who unfortunately could not be here tonight. Her dog passed from an hemangiosarcoma, and I noted part of your interest is to study the cancers and how they are transmitted, how they are carried on in the body, not transmitted from one to the other, but how they're carried on. And so she is very interested in knowing, well, what are the implications and the results and the impact on cancers such as hemangiosarcoma? Can a immune-mediated hemolytic anemia cured then be triggering some of these blood cancers?
Yeah, so I don't think there's any data to support that at all. So I think hemangiosarcoma occurs in certain dog breeds, usually the bigger dog breeds, but I mean, it can occur in any breed. So yeah, a Cocker Spaniel could absolutely get hemangiosarcoma. But, you know, think of it as like a golden retriever, Labrador retriever disease. And certainly my old Labrador retriever, Airedale Cross, died of hemangiosarcoma when he was 11. He was the first dog I got in the US, and it's a pretty devastating disease. And again, you know, why does it happen? We don't know. It's just bad luck that the dog develops that particular kind of cancer, just because it's usually a very aggressive cancer. Depending on where it arises, the ones that arise in the skin are not always as aggressive as the ones that arise internally, often in the spleen. So as far as links between IMHA and the development of cancer, there certainly are known genetic defects in humans where there's DNA repair defects that are genetically carried, and I actually have a colleague that has developed in her short lifespan multiple different kinds of cancer, and it runs in her family. And they probably have some genetic defect that affects how DNA repairs itself. And they haven't been investigated, but there's definitely something going on. It's like there's a genetic predisposition to colonic cancer. If you've had colon cancer in your family, they're going to want you to go for colonoscopies much more frequently than a family that doesn't have it. So there's known genetic defects that run in lines, but as far as links between IMHA, von Willebrand disease, any of the known genetic diseases that affect Cocker Spaniels, and hemangiosarcoma or other blood cancers, there really isn't.
I asked the questions that I have received, and I think that some of them were also answered in your presentation. The floor is open to anyone that would like to take advantage of Dr. Stokol's experience.
When we started with American cockers 50 years ago, von Willebrand's was said to only be in party colours. Back in those days, we tended not to mix the colours as much as people do nowadays. Is it what, I know you said there's not a lot of it, but is it still confined basically to party colours or right across the whole range?
So I can't answer that question because, when I looked up the defect in Cocker Spaniels, there was not a lot on it. So I don't know if anyone's looked at that. It's interesting because I was actually working with a different breed where it seemed that the defect that we were looking at, which seemed to be a defect in red cell production, because these puppies were anemic at a very young age, and it wasn't IMHA or anything. They actually had very abnormal red cells, and they were dying. It seemed to be more in this party color. So the thing is the gene for the color linked to the gene or multiple genes that are associated with the development of the trait? That is certainly possible. Because, when you're breeding specific things, you're selecting for specific genetic traits. And if you're breeding them too closely, you can cause a genetic trait that would normally manifest in 1 in 100,000 dogs to start manifesting in more dogs than that, because you're selecting specifically for that trait. And even though you're not intentionally selecting for it, if the gene that you want to select for is very close to the gene or genes that are associated or cause the trait, then you can get that happening. So I can't answer your question about von Willebrand disease being linked to the party color. Again, I can try and find information on it, but I didn't find very much written on the Cocker Spaniels to know, is it because you're mixing colors? Again, I really don't know, sorry.
We also had an interesting thing with German Spitz. It was very difficult to find a German Spitz that wasn't giving a carrier or affected result for von Willebrand's. However, because the German Spitz people cooperated throughout the world, they couldn't find any German Spitz who had bled to death, affected ones who'd bled excessively. You had bitches who'd had 2 and 3 cesareans. You had another one who was ripped to pieces by a dog, and there was no excessive bleeding. So now they they've just thrown it aside, and they're careful and they notify vets before operations that their dog has got an affected result. But, you know, that's that.
Yeah, and I mean, the studies that I did in Australia, and I studied mostly the Doberman because it was a fairly common breed in Australia, and the studies done by my colleague here at Cornell, Dr. Marjorie Brooks, has really shown a good association between severity of bleeding and the amount of von Willebrand factor. And we certainly know, like the type 3, where they don't have any von Willebrand factor, or the type 2, where they have abnormal structure as well as a decrease in the amount of von Willebrand factor, that they bleed more than a lot of Dobermans out there. There's a lot of Dobermans, and data, the genetic data from the Dobermans show that most of the Dobermans that bleed are homozygous. As far as the German Spitz, I don't know, but they could be very similar to Rottweilers and other breeds that don't seem to bleed that much from von Willebrand disease. And again, you know, why is the one breed bleeding more when they have the same type of von Willebrand disease than another breed? It's like, why did this 13-year-old Shetland sheepdog with type 3 von Willebrand disease that should have bled at some point in the 13-year-old life only bleed when it was 13 years of age, and that's when we made the diagnosis? I mean, that's kind of crazy. You think about it, because you would have predicted that it should have bled much earlier in life, but it didn't. So maybe it just wasn't challenged, or maybe again, there's an additional trigger that's needed. Who knows? I don't think we know. And in humans, there are humans with the same concentration of von Willebrand factor, and one will bleed and the others don't. And sometimes it's related to the amount of von Willebrand factor in their platelets and not the amount that's in the blood. And we don't have that information for dogs, so we don't know.
Thank you.
There's lots of I don't know here. These are great questions, by the way.
Well, the idea is to be able to share these unknowns and helps to solve them, and be able to, all of us, donate our dog's blood to research and be able to answer these questions. So they may not solve the present problem that we have, you know, at home, but it can solve the problem a couple of years down the line. So I think that that is the important objective here. So
yeah, and
also,
I think sorry, I interrupted you, but
I
agree with what you said. I think you have to have the long view that, yes, you'd like to help your own dog, but really you want to think about how can this help dogs in the future, for sure.
For sure. And the other idea is that we're all owners. Breeders, yes, I see that many of them are on, okay, but we're all owners. And then when we go to our veterinarian, we share this information. I had this discussion with Stephen Friedenberg, and he agrees that sometimes the neighborhood veterinarian doesn't get the information, you know, that is actively going on at the university level. So if we can contribute to passing on, trickling down the information to our local veterinarian, then, you know, it's also a win-win situation for all of us. So
yeah, absolutely. And I think, and actually for the Imha study that Stephen and I are running, I spoke to Stephen a little while ago, and we want to get a certain number of dogs where we have all the pristine data that we can, but at some point we are going to open it up to veterinarians sending us samples directly, because we do want to recruit more cases. And one of the biggest draw, because I know you've asked me about this and said, can't we, you know, I've got lots of people that want to provide blood. I mean, the big problem with the studies, we want to do it in the best way that we can so the data is good. And that means we need to get RNA from the dogs before they've been treated, which obviously would be getting the blood taken directly from your vet. But the RNA tubes, I waited 3 months for them, by the way, after I'd ordered them. So they were in hard supply. And I can't ship them to a vet because you got to treat the dog ASAP. They can't wait for me to get the blood tube to them. Versus the acute myeloid leukemia study, I've had owners contact me and I've been able to ship supplies to their vets to get me the samples I need for that study. But for the IMHA, for getting the RNA that we need to do, what Stephen did in that first paper, where we have to do that for at least a cohort of these dogs or a subset of them, we really have to have people with the RNA tubes, and that's Cornell, Minnesota, and the University of Auburn, where our collaborators are right now. But we decided that once we get a specific number of the dogs we need to get, then we're going to open it up so we can get more, and we just won't get RNA on those dogs because it's just not doable. But we have to get the RNA for one of the study goals to accomplish that.
Yes, yes.
So as soon as we open it up, I will let you know. You'll be the first on my contact list.
Thank you. Yes, I know that this was a topic of conversation that we had, opening up the study to different areas. And yes, the RNA tubes are a problem. So it's not something that the local veterinarian can simply stock up. So, yeah.
But we're hoping that will change, and we're hoping maybe sometime next year, probably later in the year, that I'll contact you and say, hey, let's advertise the study and let's try and get as many IMHA samples as we can. And we know not all of them will meet our criteria for inclusion, but we'll do the best we can. It's better to have more dogs than none, so.
Absolutely. And then also to be able to speak with the veterinarian to actually get the more information as to what really happened, and to get a good differential diagnostic, which is important. Yes.
Yeah, absolutely.
Anyone else? Any additional questions? I don't see anything in the chat. My phone is not going off. So I don't want to keep you much longer. I thank you so very much for answering all of our questions and for this wonderful presentation. We hope to have many other presentations, and we are looking forward to the results of your study.
Well, thank you so much for those kind words. It was an absolute pleasure to talk to you guys and to answer your great questions. And even though I couldn't answer a lot of them, I wish I had the answers to them, but unfortunately we just don't know. But I really appreciate your enthusiasm and passion for wanting to do the best thing for your dogs and to support the kind of research that a lot of us are doing. So that's great. So continue the good work, and thanks again.
Well, thank you very much, Tracy, and we'll be emailing back and forth.
Great, and happy holidays, everyone. Okay.
Happy holidays.
Bye.